My name is Urvi Bandurkar and I am a first year BAMS student at Gomantak Ayurved Mahavidyalay, Shiroda, Goa. The topic that I'll be speaking on will be Sparshana Pariksha. But before that, let's have a brief intro into the topic. In Ayurveda, the diagnosis and treatment of disease is always based on the constitution of an individual or a patient's prakruti. As such, it is known as a highly accurate and personalized method of analyzing every kind of disease. There are different stages of diagnosis of disease in Ayurveda. The essential element in this type of treatment is to find out the root cause of the disease or the illness. The diagnosis or analysis is done by getting knowledge through the means of praman, examination and investigation, and this is called pariksha. Pariksha helps us in understanding the signs and symptoms, the prognosis and the other features regarding the disease in order to plan out the appropriate treatment for it. There are two types of pariksha, Roga Pariksha and Rogi Pariksha. So Roga Pariksha is the analysis of Vyadhi or the disease, the various causative factors or the hetu of the disease, its signs and symptoms, its prognosis, its accumulation and action in the body, how it is being expressed, the type of disease, its treatability, and coming up with a therapeutic approach. Next is Rogi Pariksha. Rogi Pariksha is the examination of the Rogi, which is the patient suffering from the disease, and for assessing the specific symptoms, there could be 3-fold examination, 8-fold examination, 10-fold examination, criterias, etc. We'll be looking at the 3-fold examination. The 3-fold examination, or the Trividha Pariksha as it is called, consists of Darshana, Sparshana and Prashna. Darshana is the inspection, Sparshana is palpation and percussion, and Prashna is interrogation. Darshan is wherein a patient is assessed for any enlarged or shrinked body part, discoloration, visible symptoms, color and shape of the body language, dryness or excessive oiliness of the skin, eyes, etc. Prashna, in Prashna there is like general interrogation such as name, age, sex, address, profession of the patient, history of previous illness, any family history diseases or hereditary diseases, any addictions, the diet, the habits, pediatric problems, sleep pattern, etc. Let us look at Sparshana Pariksha in detail. In this method, the medical practitioner examines the patient by touching. The factors which sometimes cannot be understood by inspection are better known by palpation. So the cognitive organ of touch, that is skin, or the Sparshanendriyam, carries out this examination. Let us now take a look at a few examples of Sparshana Pariksha. They are important in the analysis, treatment and diagnosis of various diseases and conditions. One of the very important palpation methods in Ayurveda, that is Nadi Parikshan. Nadi Parikshan is nothing but pulse examination. The medical practitioner or the Vaidya examines and analyzes the pulse of the patient. the gati or the speed of the pulse. The type of movement of the pulse also shows the functions of the different major organs of the body. Another example is the palpatory method of blood pressure measurement using the sphygmomanometer is done by palpating the radial artery at the wrist joint. One of the commonly used palpation methods, that is palpation of the lymph nodes in lymphadenopathy. Enlarged lymph nodes are signs of infection in the body. Commonly palpated areas are the axilla or the armpit and the region of the neck and the jaws. By palpating, diseases like liver and spleen enlargement in cases of anemia, cirrhosis of liver, cancer in the liver, and formation of stone in glands, appendicitis, are also done through Sparshana Pariksha. Another very commonly used method is the examination of the size of the uterus and the position of the fetus or the baby in a pregnant woman. Also, the two-finger test is done to check the dilation of the cervix at the time of the delivery. Checking of body temperature for fever using Sparshana Pariksha is something we all very commonly do even in our homes. Palpation of benign or cancerous growths is another example. Especially in the breasts, signs like presence of hard masses or tenderness of the breasts is checked by the doctor. Palpation is also used in cases of abnormal growths and elephantiasis, and also in pitting edema to check the amount of fluid accumulated. In cases of leprosy, Sparshana Pariksha is helpful to know about the loss of sensation and also in feeling of the bone fragments and understanding the type of fracture. These are just a few examples of Sparshana Pariksha that we have seen. Many other such palpation methods, such as palpation of the testis, palpation of tonsils and other glands, and also in understanding the type and severity of burns, etc. All of these form an important part in Rogi Pariksha. Now we understand that in Roga Pariksha, one needs to have textual knowledge. But for Rogi Pariksha, a physician needs to have good skill, intelligence, long practice, training and sharp perception ability. The factors understood by palpation are reflexes, rigidity or softness of different organs, temperature of the body, texture of the skin, swelling and tumor, flatulence and ascites, stages of different wounds and ulcers, intraocular pressure, etc. Sparshana Pariksha helps in finding the added information which are not accessible by Darshan Pariksha or inspection. Hence, Sparshana Pariksha is an important tool for diagnosis.